50 65 चीनी डाल के दूध पिला रही है क्या?
ज्वाइन कर लीजिए सभी को।
पहले तो 50 65
So we are live now. Is my screen visible to everybody?
Yeah.
Yes.
Yes, sir.
Okay.
Able to.
Yeah. Shall I start?
Yes.
Yes.
Please.
Okay. So good evening, all delegates and faculty members. I Nitesh Srivastava on behalf of Corona Remedies Limited in Core Connect webinar. Welcome you all in association with AMOGS Sexual Medicine Committee and in association with Haryana Ops and Gynec Society. So before proceeding further to this program, I would like to introduce and welcome the conveners and coordinator of today's program. Okay, so I would like to introduce and welcome Dr. Uh, Madan Kamble. Dr. Madan Kamble is consultant ops and gynae sexual health expert and he is aesthetic gynecologist. Dr. Madan is chairperson AMOGS Sexual Medicine Committee and national coordinator in FOXY Sexual Health and STI Committee. He is the past secretary and president Acclus Ops Gynae Society and he has secured awards like Wonder Amoxian Awards, Legends of Gynecology Award. So I welcome Dr. Madan.
Thank
Then
you.
I would like to welcome Dr. Prerna Krishan. Dr. Prerna is infertility specialist and endoscopic surgeon, and she is master in cosmetic gynecology. Dr. Prerna has secured so many national and international publications like journals, newsletters. She has secured national positions like Zone Leader, chairperson in IMA Assam, Safe Motherhood Committee, and she has secured so many national awards. So I welcome Dr. Prerna in today's webinar. Then I would like to introduce and welcome the coordinator of today's program, Dr. Parul Saoji. Dr. Parul Saoji is infertility specialist and laparoscopic surgeon and aesthetic gynecology consultant. Dr. Parul is chairperson in Young Talent Committee AMOGS. She is the president 2022 in JCI Nagpur Medico and she is the member at AMOGS Infertility Committee and AMOGS PAC Committee. And she is the executive member at NOGS and she has secured some winning in AMWI Golden Jubilee Award, Dr. Chetan Semelkar Award. So I welcome Dr. Parul in today's webinar. Now I would like to hand over this session to Dr. Parul. Dr. Parul, I hand over this session to you.
Thank you so much. A very warm good evening to each one of you. Welcome to today's webinar on sexual health and wellness. Sexual health is a very vital part of overall well-being. It's about much more than preventing diseases. It's about understanding your bodies, building healthy relationships, making informed choices, and promoting respect and safety for ourselves and others. Today, we are bringing together experts and advocates who will share their knowledge, answer each question, and help us break down the stigma often surrounding this topic. To begin with, I would welcome Dr. Madan Kamble, who is AMOGS Sexual Medicine Committee Chairperson, to give his welcome note. Over to you, Madan, sir.
Thank you, Parul. It's my privilege and honor to welcome you all on this platform. We are so delighted to have the collaboration of AMOGS with all the Ops and Gynae societies of Haryana. By heart, I thank all the seniors in all the societies of Haryana, or past presidents or any seniors of FOXY, which are from Haryana, for this cooperation and accepting my invitation. I also thank all these societies like Ambala, Faridabad, Karnal, Rewari, Sirsa, Hisar, Sonipat, Panchkula, Yamunanagar, Rohtak, Palwal, Gurugram, and Bhiwani, all 13 societies. We are so happy that seeing the attendance and participation from all the societies by the president, secretaries, and all seniors of the societies. On behalf of AMOGS, I welcome you all with the blessings of AMOGS office bearers, Dr. Kiran Kurtkoti sir, who is the president of AMOGS, and Dr. Bipin Pandit, who is the secretary AMOGS, and Amey Purandar sir is also here, who is the senior vice president. I welcome today's chief guest, Dr. Narendra Malhotra sir, today's guest of honors, Dr. Amey Purandar sir, Dr. Mala Arora ma'am, Ragini Agarwal ma'am, Nisha Kapoor ma'am, and our own Mitra Saxena ma'am. I also welcome my co-conveners, Dr. Prerna, Farul, and I welcome all the speakers, all the chairpersons, and my dear friend Girish sir, and all the panelists from Haryana societies. I welcome all and all the attendees who have joined today's program. Thank you so much. Then I request Nitesh, please display the. Have the sir joined? Narendra sir? Prerna?
नहीं ज्वाइन किया है
Sir is not there, I think. It's okay. We will welcome sir whenever he joins. I welcome Dr. Amey Purandare sir, who is the guest of honor. Please display the CV. Yes. He's the dynamic person from AMOGS and president-elect AMOGS. Currently, he is the senior vice president. He was joint secretary of FOXY in 2019. Also, he was past chairperson of FOXY. He is one of the dynamic personalities of AMOGS. I welcome Amey Purandare sir as a guest of honor. I think sir is not there. Yeah, sir, you are there. Over to you, sir. Yeah, we need your blessings.
Thank you, Madan, for this.
Sir, your voice is breaking. Voice is breaking.
It is a privilege and an honor for the factor network area, so please bear with me.
Yes.
I wish Madan all the best for his future endeavors, and I'm indeed very happy to see a fantastic program that he has put together and curated for this webinar. Madan has been working very sincerely in the AMOGS Sexual Medicine Committee over the last 2 years and has really ensured that this committee reaches all the members of AMOGS, and various topics which we are not aware of have been our members have greatly benefited in the understanding of those topics. Madan is also one of the key people who is organizing a special conference specifically on sexual medicine, which is going to be held in Kolhapur under the aegis of AMOGS and Kolhapur OBGYN Society. So once again, I'm very much thankful for this invite, and I wish Madan and the rest of you all the best for your future endeavors.
Thank you so much, sir, for being with us. Thank you so much. I welcome Narendra Malhotra, sir. Please share CV. Malhotra, sir, CV. Nitesh. Yes, sir is there. We are so happy to have Malhotra
I'm
sir.
there, I'm here.
Yes, sir. Thank you so much for joining, sir. Sir is the past president of FOXY, one of the dynamic FOXIans. And over to you, sir. We need your blessings, sir.
Very good evening to all of you. It's indeed a pleasure to be here in this AMOGS meeting, webinar on sexual medicine. Now, we all know today that sexual health is more important than just physical and mental health. And that's a complete definition of health. And so there is very, very less awareness amongst gynecologists, amongst patients. Every day, if you take a history, you'll find that there will be 30-40% of the patients who will have severe or some of the other sexual problems, male or female, everything. So congratulations to Dr. Madan Kamble for organizing this wonderful webinar. And I see some very nice topics, which will definitely benefit the practicing gynecologist on how to handle these sensitive topics. So congratulations, AMOGS. And I'm sure the conference which you're organizing at Kolhapur will be a great hit. And if I have those dates free, I will definitely be there along with you physically. Thank you for inviting me. All the best to your future endeavors. All the best to all the participants and the faculty and those who are listening. Please listen to this problem carefully, because this is the next super specialty in OBGYN which is coming. Thank you for inviting me.
Thank you so much, sir. Your words are great blessings for us always. And always you are with Foxy and AMOGS in each program. Thank you so much, sir, for joining today. Over to Prerna for to invite next guest of honors. Yes, Nitesh.
Thank you.
Mala.
Thank you, Dr. Madan, and thank you, sir, and thank you, Ramya sir, and thank you, Naren Malhotra sir, for being here. We have our next guest of honor with us, Dr. Mala Arora ma'am. Dr. Mala Arora ma'am is the chairperson of ICOG 2017, vice president of Foxy 2011, editor journal of RPL, and the founder of Indian RPL Foundation. Ma'am is the vice chairperson of International Society of RPL and chief editor of Recurrent Pregnancy Laws for various editions. And ma'am has numerous awards and credentials to her throne. And we welcome you, ma'am, and we are so very honored to have you amongst us. Dr. Mala Arora ma'am, for your blessings, please.
Thank you so much, Dr. Prerna and Dr. Madan, for inviting me. I think your committee needs to do a lot of work, because as chairperson of the Recurrent Pregnancy Loss Foundation, I feel not among doctors, but even public awareness to seek help so that their reproductive careers progress all right. I wish you all the best, Dr. Madan. I'm very happy that you're organizing a conference, and certainly a great event. All the best. Thank you.
Thank you so much, ma'am. Thank you so much.
Thank you, ma'am, for your words of wisdom, and it's always an honor to hear you, ma'am. And we now welcome our next guest of honor, our very beloved Dr. Ragini Agarwal, ma'am, past Vice President of Foxy from the North Zone. And ma'am is a aesthetic and functional regenerative gynecologist and has been working relentlessly for the upliftment of female sexual health in this part of the country for so many years now, in a pioneer in the field of aesthetic medicine, we can say. And ma'am is the Secretary General of IMS 2025 and founder secretary and founder president for so many organizations. Ma'am so has so many awards and credits to her publications, and has authored numerous books of academic repute. We welcome you, ma'am, to this prestigious AMOGS webinar, and we need your blessings for this, ma'am. Over to you, Ragini. Ma'am, you're muted. Muted. Ragini, you're muted.
Thank you, Prerna, for your kind introduction. Very good evening to one and all. And as this program of AMOGS is with Haryana, so I welcome you all to the land, or I can say the internet of the Haryana. And I'm so happy to see here, specifically Dr. Rao. If we're talking about the sexual health, and the presence of Dr. Rao is really made this webinar beyond expectation. Every single person who has joined is a lucky to listen the pearl of wisdom from a person who I might say the father of the modern sexual health for the allopathic practitioners. So my heartily welcome to Dr. Rao also to among all gynecologists. And you and Madan both are doing a wonderful job. This sexual health is a very, very neglected thing. Although if we think the whole OBGYN is born from the sex only, but never and never we have focused ourselves on the sexual history, sexual dysfunctions, and whatnot. We treat the infertility without taking the sexual history. So the first topic of the sexual history, which is being taken by the Dr. Kamble, is a one thing that we should institute in our day-to-day history taking, and the whole discussion of the panel discussion with Prerna will give a very deep insight to everyone to treat their patient and help the women for their quality of life also. So I will not speak much. I welcome you all again. I am so happy to see my all friends from the Haryana, especially Mala after ages, and everyone from all society of the Haryana. Thank you so much. Over to you for the academic proceeding.
Thank you, Ragini. It's
Thank you so
always
much, ma'am.
Dr.
Thank you
Madan,
so
are you
much.
taking it or should I continue?
Yes, Parul, please welcome
Yes.
Mitra ma'am and TSS Rao sir.
Oh,
Yes.
Isha ma'am also.
I
Yes,
think Nisha ma'am has joined.
I think she's not picking phone, but Nisha ma'am is the president of her OBGYN, and we welcome Nisha ma'am, but I think she is busy, not receiving call. Whenever she joins, we will welcome her. Yes, Mitra ma'am.
So it's indeed an honor to invite Dr. Mitra Saxena ma'am, who is the director at Sri Ashwini Saxena Hospital, Rewari. She has been the chairperson for Practical Obstetric Committee, FOXY, and she is the vice president elect from North Zone. So that's indeed an honor. And ma'am, we've been hearing all sorts of whatever webinars you are conducting, and it's indeed an honor to have you on this platform with us. Over to you, ma'am, for your blessings.
Yeah, I was looking at the watch and we are already going to finish half an hour and we have to get on with the academics. So a very, very warm welcome to all of you to Haryana digitally. And it's we've become member of the Foxy family. So we know everyone who has joined. So welcome to you, Dr. Amaya, Girish, Dr. Malhotra, Dr. Rao, and of course our own
Thank you.
family. है ना, आप लोग तो बाहर से आ गए हो, आउट ऑफ हरियाणा हो, बट हमारे हरियाणा वाले एंड पारुल एंड प्रेरणा एंड मदन ऑफ कोर्स, बट रेस्ट इज माय ओन होम टीम, हमारे घर के फैमिली मेंबर्स हैं. आई एम सो हैप्पी दैट एवरीबडी हैज जॉइन and the topics are so good, and actually I've had the privilege of attending all the webinars very sincerely because Dr. Neeraj is like हम लोग का फॉक्सी में क्या होता है ना, सेम बैच के होते हैं, तो हम सेम बैच के थे, तो I have always joined his webinars and I've heard Dr. Rao and Madan do such a lot of work, and really like what Dr. Narendra said and what Ragini have said, the sexual history is something which is very, very important, which lot of people are uncomfortable talking about it, and doctors agar hesitate karenge to how will we get on to the crux of a problem. So many times the marital mess and family maladjustments are only because the sex life is very, very sad and nobody has addressed it. So basically I think that Madan, you are doing an excellent job. My best wishes to you, Madan, Prerna, and Kiran, Chandna, and all of you, Girish, whoever is in this job of taking academics ahead, and of course a brilliant career in Foxy as well. And thank you for coming to Haryana, and over to you for the scientific session. Sabko bahut pyar, or let's enjoy the academics now.
Thank you so much, ma'am. I
Thank
would
you so
also
much, ma'am.
extend a warm welcome to TSS Rao, sir. It's indeed an honor to have you, sir, and especially you logging in from Srinagar, especially for the webinar. It really means a lot to us, sir.
Thank
So
you,
if
sir.
you could just
All
speak
the
few
best.
words for your blessings, sir.
Thank you.
I would welcome all our chief guests, guests of honor, and our dignitaries to join in for the auspicious virtual lamp lightning.
असतो मा सद्गमया तमसो मा ज्योतिर्गमया मृत्युर्मामृतं गमया ॐ शान्ति शान्ति शान्ति.
Now, without much ado, we'll be starting our first scientific session, which is sexual history taking. So I would like to invite the chairpersons, Dr. Sunita Hujama, who is the consultant at Capital Child and Maternity Center, Faridabad. She's the executive member of OBGY Society, Faridabad, and she has been associated with IMA, Menopause Society, and MPH Mission, Faridabad. We welcome you, Sunita Ma. The next one, the next chairperson, Dr. Lieutenant Colonel Gurneesh Singh, sir. He's the organizing chairperson for the 4th annual Haryana OBGY conference, which was held. He's the president for Hisar OBGY Society. He's a former professor and HOD at Department of Obstetrics and Gynecology at Agrasen Medical College, Agroha. We welcome you, Gurneesh, sir. And the third chairperson for this session, Dr. Renu Chakravarti ma'am, who is the consultant and obstetric gynecologist at Chakravarti Nursing Home, Panchkula, Haryana. She has been a gynac for practice in practice for the past 36 years. She has been associated with Ministry of Health, Iran, as consultant obstetrics and gynecologist for the past 4 years. She's a senior consultant in charge and HOD for Department of OBGY at Chakravarti Nursing Home, and she's heading the Panchkula OBGY Society. We wholeheartedly welcome you, Renu ma'am. I would now request the chairpersons to introduce our dynamic speaker, none other than Dr. Madan Kamble, sir. So over to the chairpersons for introducing our first speaker.
Good evening, respected all. I welcome Dr. Madan Kamble, sir, chairperson AMOGS, sexual health expert, is an aesthetic gynecologist, to speak on the topic sexual history taking. Thank you.
Thank you so much, ma'am. Is it visible?
Yes, sir.
Okay. 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 Thank you all the chairpersons and for kind introduction. Thank you all the guests for joining today's webinar and blessing us. Let us move forward to the actual scientific. I will be talking on sexual history taking. Since our undergraduate days, we all know how to take history. We all have learned all the steps of basic history taking. But today we are interested in dealing how to take the sexual history. And we are more focusing on the sexual history. Because sexual history is the basic to reach any diagnosis of any sexual disorder and manage accordingly. We all know the sexual health can greatly impact the overall quality of life. Actually, it should be a routine part of your healthcare or any or clinics or any OBGY patient we see. It should be included in our routine history taking, sexual history. That means we have to start asking about the sexual history, because this will allow us for the high quality patient care, and by appropriately assessing and screening the individuals for many sexually transmitted infections or any sexual health problems. And for that, comprehensive history taking is very much needed to reach to the ultimate diagnosis and to manage accordingly. Then what is important regarding this? What I suppose is, first, it is very necessary to create a clinical environment for the same. Then how to create a clinical environment. Creating a welcoming clinical environment for all patients should start at the registration only. We all know these procedures. First, the patient is get registered, then establish your patient's name, pronouns, as well as the sexual orientation and gender identity. These two things are very important to assess the sexual orientation and gender identity. And then have a consent for history taking and going ahead. At least oral consent is very much necessary. Gender identity is independent of sexual orientation, and it may be decided by or determined by a two-step method of clinical assessment, that is sex assigned at birth. It may be female, male, or the client may decline to answer, and also ask about the current gender identity, maybe female, male, transgender, male, or any other category. At the same time, we have to look for that some patients may not be comfortable talking about this sexual history or giving the answers to our questions. They may not be comfortable. We are going to ask about the sexual partners or sexual practices they are having. We have to ask about any experience of sexual abuse or trauma in their past life or current life. Also, it is very important to let them know that taking a sexual history is an important part of their regular medical care. And we can simply offer some tests also. It can be a better approach to go further. As with other history taking, we must consider how to put the patient at ease, find out the real problem, and discover the patient's background and clinical history, then work out a plan of management with the patient. These are the just outline for the assessment and management of the patient. Then general communication skills, how to communicate with the patient. First is the professional attitude. Our attitude should be professional. That means we should be very polite, or there should be a welcoming environment. We should welcome the patient. Self introduction is necessary. For example, I'm Dr. Madan. I will take care of your any complaints or any problems. Please be free and talk with me. Be open. Thus, we have to make comfortable the patient and always be cool and polite. Again, most important is the non-judgmental. Always be non-judgmental. Listen to both partners. Listen to both partners and never try to judge who is right, who is wrong. Your body language. You should be confident. Your confidence should display on your face. The patient will be more comfortable. The history of both the partners is very necessary. First, we can take the individual history. Again, with his partner, we can take the history in detail. And last but very important is to ensure the privacy and confidentiality. This is very, very important, because we should assure them that our discussion is going to remain completely private and confidential, so they don't have to worry. Then they will get relaxed and open up. These are the basic history notes we have learned. This is common for all history, that is patient's name, age, sex, address, religion, marital status, occupation, education, contact details, in family members history, the past history, personal history, family history that we have to ask. And important histories are medical history, surgical history, obstetric history, and sexual history. In medical history, we can ask about any medical diseases he or she is having, or any drugs they are using, any surgical history, any major surgeries in the past, or we have to ask about the details of obstetric history, whether she has had normal deliveries or cesarean section or any other surgeries, tubectomy or any laparotomy or any surgery for any pelvic pathology. Then last is the sexual history that we are going to discuss in details. Then how to start with. There are a few questions that we can ask as a leading question, or to start with, we should ask the light questions to make the patient comfortable. For example, may I may I ask you a few questions about your sexual health and sexual practices? I understand that these questions are personal, but they are very important for to solve our problem or your overall sexual health. And at this point in the visit, I will ask some questions regarding your sexual life. Is it okay for you? These questions to be asked to make the client comfortable. And also, this is one of the type of gaining the oral consent. Ask this question to all the patients, regardless of age, gender, and marital status. And also assure them that these questions are as important as the questions about other areas of your physical and mental health. And also assure that this history which the patient is going to give, it will be kept in strict confidence or in a confidential. Also, we can ask, do you have any questions before we get started? That means we can allow the patient to talk first, to open up first about his or her complaints. Do you have any questions or concerns about your sexual health? Let him or her speak first. That can be one of the options. Then afterwards we can go ahead. These are some pre-consultation questionnaire. These are the sexual health questionnaires. Left side is for sexual health inventory for men. The right side is shown is the sexual health inventory for female. Many universities or many clinics have prepared their own customized questionnaires, which can be very helpful to reach the diagnosis or to save our time. Then how to go ahead, how to question the patient. There can be open questioning or closed questioning also. Open questioning means, how can I help you? What is your problem? What do you think caused this difficulty or your problem? And some closed questioning like in the answer may be in the form of yes or no. Have you had this problem before? Did you practice safe sex? Then he or she can answer in yes or no. Then finding out the problem. To take care to avoid the words like impotence, and always careful and tactful illustration is needed, and vagueness should be clarified. Always be specific. The use of terminologies. Which terminology should be used? Whether to bring vernacular terms or medical terms in discussion. And use of treat versions may assume a very relaxed and empathic discussion. As far as the rural area is concerned, we can use the local words which can make the client more comfortable to involve in the discussion. Then main domains to discuss about these male and female problems are the desire, arousal, penetration, ejaculation, orgasm, and pain. These are the main 6 domains. Then what we have to ask about this? All the questions are related or directed with these 6 domains. Ask about the onset of problem, duration of the problem, severity of problem, and progress. How it is progressed for over the time, and are there any aggravating factors which he or she suppose, or any relieving factors are there, or any associated factors to cause this problem, or they are suppose that these factors have caused my difficulty, or increasing my difficulty, or any associated factors this might have caused the difficulty. We have to go in the details of these predisposing factors. Then how to evaluate clinically these cases. Sexual identity and sexual orientation, that has to be assessed and addressed well. Then sexual activity and function. Ask about the sexual activities, their sexual activities, routine sexual activities, and sexual function, whether it is normal or is there any problem, or are there any myths or misconceptions about the sexual activities? Always ask about the or assess about the general health status, and assess for the comorbidities like some endocrine disorders may be there, diabetes, hypertension may be there. Uh, he or she may be on any medications of anti-diabetic, anti-hypertensive, or anti-psychiatric medications may be there, which can affect their sexual practices or sexual health. One more important point is the interpersonal relationship factors. We have to ask how is the relation between the partners, whether it is disturbed, whether uh, there is significant stress in their relationship, and this is very important as far as the uh, sexual dysfunctions are concerned. In some cases, cultural and religious factors also play very important role in the formation of these sexual disorders. And personal expectations may be uh, many times may be wrong, maybe mismatching, and that is creating this sexual dysfunctions. Then there are 5 P's for sexual behavior history taking. Then which are these 5 P's? What is their significance? How they are useful? These 5 P's are partners, practices, protection from STI, past history of STI, and pregnancy prevention. Let us see one by one in short. These are the areas that you should openly discuss with your patient. And what is the goal of these 5 P's? It is to improve the patient's health, to solicit the full disclosure of the sexual practices, especially when they are not compatible. Our main history will go around these 5 P's. Then about the partner, we have to ask the details about the partner. Are you currently having sex of any kind? Means that may be oral, vaginal, anal, or with anyone. If no, have you had sex of any kind with another person? In recent months, how many sex partners you have had? And what are the genders of these partners? Do you or your partner currently have other sex partners also? If a patient has had sex in the past, but it is not currently, it is still important to take a sexual history. Then about the practices, we have to ask more specific questions about the kinds of sex they have had in last 1 year to better understand the risk of for the STIs. Then what kind of sexual contact do you have or have you had? What parts of your body involved means whether it was genital sex or anal sex or oral sex. We can also ask about are you top or bottom? Do you meet your partner online or through apps? Have you or any of your partners using drugs? Have you exchanged sex for your needs? These questions are to be asked to them as far as the sexual practices are concerned. Then assess their knowledge of STI or protection from STI, prevention of STI. We have to assess their knowledge also, and we have to give the education also. Do you and your partner discuss about the STI prevention? We have to assess whether they know about STI. If you use prevention tools, then which tools you are using and how often you are using? What is the frequency? When you use, when you don't use, that we have to ask. In which situation you are using and not using? Have you received HPV, hepatitis A, B prophylaxis? Do you know the post-exposure prophylaxis? What is the medicine for it? What is post-exposure prophylaxis? We have to ask and explain them. The past history of STI. We have to ask few questions regarding this. Have you ever been tested for STI or HIV? Would you like to be tested? Have you been diagnosed with an STI in the past? When? If yes, then did you get the treatment for that? Have you had any symptoms that keep coming back? Has your current partner or any former partners have been diagnosed or treated for STI? Were you tested for the same? Do you know your partner's HIV status? There are so many questions that we have to ask in the sexual history. Then prevention strategies for STI. First and most important is the not having sex, but it is practically not feasible. But mutual monogamy is very important. both partners having sex with only one partner. Then use of post-exposure prophylaxis and using condoms every time. That can be the prevention strategies for STI. Then about the pregnancy prevention, we have to ask few questions whether the client know how to prevent pregnancy or any methods to prevent pregnancy. The questions like, do you think you would like to have children at some point? When do you think that might be? How important it is for you? Are you or your partner using contraception, and which type, which pills or condoms? Do you want to have some information about the birth control? Would you like to talk about the prevention of pregnancy? These questions, these are the leading questions we have to ask. Then we are coming to the final touch-up of the consultation. Then we can ask the other questions like what other concerns or questions regarding your sexual health or sexual practices you would like to discuss. We can let them talk or let them talk anything what they want or they want to tell about their sexual practices. Don't forget about to ask a past history of any trauma or sexual abuse or any sexual violence in the past. That is very, very important history. Also consider asking about the sexual functioning, including the pleasure or performance and or any referring for care. Always summarize the key points back to the patient. What we have discussed, always summarize and talk to the patient. And this point is very important to reaffirm the confidentiality that what we have discussed here, this will be 100% confidential and private discussion. At this point, we can thank the patient for being open and honest and always point out and encourage any protective practices. Last part is the agreeing a management plan, how to go ahead. This is the final part of history taking. And always management plan is to be discussed and agreed with the patient. And always involve the partner for a meeting, couple counseling. And we have to discuss our plan, how we are going to manage this case. And what will happen? Patient will feel that partnership is between doctor and us, and our treatment is more likely to succeed. They will be relaxed and confident about the treatment and about the doctor also. Yes. Thank you so much for patient listening.
Thank you, Dr. Madan. Over to the chairpersons for your valuable inputs.
Thank you, Dr. Madan. It was a very detailed history taking, but there are certain aspects which we like. Other than 5P, there is 6P also. Whether the patient was satisfied with his sex life or not. The other P also like permissions or the other thing. And sometimes it is very difficult for us, especially gents, to talk to ladies and all. We can use chatbot or AI module that chatbot can talk to the lady or couple, and we can take out the more information by improving the environment around them where they feel like more privacy and everything.
Yes, sir. We agree with your point, sir. Use of AI or any this chat, any apps or any providing the pre-consultation questionnaires also. We can make them free and it will help us to reach the diagnosis. Yes, sir. Thank you so much.
Thank you so much, sir, for the detailed discussion on methods of sexual history taking, which is very important, like making the patient comfortable, maintaining the confidentiality, and then management planning as per the sexual problem of the patient. Thank you so much, sir.
What I suppose is our main aim of this FOXY committee or any AMOGS committee of sexual health is to aware our gynecologists that at least we should start asking the sexual history in our OPD. All of we are dealing with infertility patients, and so many infertility patients are having sexual dysfunctions. But in our busy OPD, we don't ask or don't waste time in asking that also. That we have to start asking at least. That's why the sexual history taking is very much important, what I suppose. Thank you so much.
Thank you so much, Madan sir, for that eye-opener talk. And I think it is a must for all gynacs to take this history, especially in this era of infertility, which is totally seeping in our patients. Over to Prerna ma'am for session number 2. So over to you, Prerna ma'am.
Thank you, Parul, and thank you, Dr. Madan, for that extremely informative, exhaustive, and an elaborate talk on the sexual medicine. And we now move on to our second session. I thank all the previous chairpersons for their valuable inputs. And our second session is on premarital sexual counseling, a very, very pertinent topic in today's era where very young children, very young, maybe adolescents are also getting into premarital sex. And we hand it over to our very esteemed speaker, Dr. Kiran Chandana ma'am, who's the president, Faridabad Society. May I have the chairperson's CV, please? We have first chairperson, Dr. Chanchal Gupta ma'am. She is the director and HOD of OBGYN from Yatharth Super Speciality Hospital, Faridabad. And she is a past joint secretary of FOGS and secretary FOGS Society and life member of Harbugai. Ma'am has 22 years of experience in the field of with the interest of hysteroscopy, high-risk obstetrics, and preventive oncology. Ma'am was the organizing secretary of HageCon 2018 and also MTPCon 2022. We are so very honored, ma'am, to have you amongst us and to chair this esteemed session. Our next chairperson is Dr. Harsha Shekhawat ma'am. Harsha Shekhawat ma'am is from the Bharati Vidyapith Medical College. She has completed her MBBS and she has various awards and credits to her throne. And she has from the Ahmedabad under the mentorship of Dr. Jayes Amin sir, she has completed a fellowship in reproductive medicine. Ma'am has published papers in IORC journals and has many professional memberships to her credit. We welcome ma'am to this esteemed session. Our third chairperson is Dr. Suman Masi. Dr. Suman Masi is from the Yamuna Nagar Society, ma'am, and she has her FOGSI recognized training in lab histero and is a consultant IVF specialist at Miracle Test Tube Baby Center, Yamuna Nagar. Ma'am is the present president of FOGSI Yamuna Nagar Society, and we welcome you, ma'am, to this esteemed session. We are so very honored to have you all amongst us. I hand it over to Dr. Kiran ma'am now for her deliberation. Dr. Kiran ma'am.
Thank you, Dr. Prerna. Let me share my slide. You have to stop share the first. Yes. How to make it full screen now? Yes.
There's the cup, yeah.
Good afternoon, everyone. And I must thank Dr. Madan Kamble sir and Dr. Prerna for giving me this opportunity to present this topic. The topic given to me is premarital sexual counseling. We all know that marriage is most important event in individual's life. It is a union of not only two individuals, but of family and friends. And when we are preparing for marriage, it involves more than throwing a party to celebrate the event, and quality time is needed to build a solid foundation of the relationship. We face some problem when the couple is preparing for marriage, like the communication issue, difficulty in managing the conflicts also, and there are differences in goals and expectations. There are different past relationship trauma with amongst the partners too, and there's concern about the intimacy and relationship. So there is need of premarital counseling, and it is a therapy of both the partners that aims at helping them grow in intimacy and connect to the deeper level. educating the partners for their journey of life to handle the ups and downs of the family of the life. It includes general counseling, medical counseling, genetic counseling, nutritional counseling, along with the important part is sex education and the sexual counseling. Whenever the individual gets married, the whole family is preparing to welcome the new members of the family, and they are planning. There is a lot of role of wedding planners too, and the couple starts getting many advices regarding the event attire and the dance performance, but nobody talks about the sexual relationship. So it is important. It is a central issue in the relationship, and they're saying that the sooner the couple can start having the healthy communication about the sexuality and their expectation for their sexual relationship, the sooner they will find harmony in their sex life together. So it is very important. So premarital sexual counseling is very important. The aim is to build comfort in discussing the sexual concerns and desires openly and respectfully. The key points in these are expectation regarding the physical and sexual intimacy, sexual compatibility, and communication about the sex and dealing the differences in desires and the preferences, and to know the frequency of sexual activity and establishing what is the off limit. Reason why the couple should go for premarital sex counseling. We as practitioners have been facing so many case scenario in our day-to-day life. Many of our patients, they come with severe hemorrhage due to the use of some sexual toys or forceful intercourse on the first night because they are under the pressure. They don't know what to do. And many of the patients, infertile patients, they come to the infertility treatment due to the family pressure. When they come to us, when we take the sexual history, they don't have any knowledge of the sexual act also, and even it has been found in very educated patients also, and also those who are well-to-do families too. And many of the patients, they had got the marital discord, there was blame game, and there was no consummation of marriage, and it was because of the vaginismus. And one of my patients that has, she was complaining that she wanted divorce from the husband. She was married only for 1.5 months. She was saying that her husband is important. But when we examined the patient husband, he was all right. And when we examined the female, she was found to be pregnancy positive. And because she was not getting the orgasm, so she was worried, and she was saying that the husband is important. And one of the patient couple that came to my friend's clinic, and she just wanted only IUI only, but on history it was found that they didn't want any sexual relationship, and they were married under the family pressure, and the husband was found to be gay. And many of our patients, they come to us for the MTP because they get pregnant in first or second month of the marriage because they don't know what is the contraception they should use, how they should plan their pregnancy. Many of the couples, they come with the late marriage, they are busy in the career, and they come in late 40s, they come for the infertility treatment also. And there has been many patients of performance pressure on their first night, and also the couple who was getting treatment for infertility, they have got performance pressure in the mid-cycle also. In many of the patients, they have got unpleasant relationship due to the sexual hygiene, which is concern for the partner. So in our day-to-day practice, we get two types of patients. One patient who are sexually active before marriage, they come with the problem of STD, unwanted pregnancy, and others, they are sexually inactive even after marriage. They come with the problem of marital discord and infertility also. So the components of premarital sexual counseling, they are the open communication. They should discuss their sexual dislikes, frequency of sexual activity, what are their fantasy, and all this should be discussed in a non-judgmental manner. And there should be improvement in the communication amongst the partners and about their needs and desires. They should resolve their conflicts in a constructive manner, and there should be sex education of the partners. The sexual health issues like STDs, contraception, pregnancy planning, they should be addressed to this in the premarital sexual counseling also. And the other aspect that are discussed in this counseling are the beliefs and the values, finance issues, and the roles of partner in the marriage and in the family relationship. And who should seek the premarital sexual counseling? Premarital sexual counseling is beneficial for all the couple regardless of their backgrounds or prior experience, but it is especially helpful in couples of different cultural and religious backgrounds regarding the sex, or the partner who have got different levels of sexual experiences. It is useful in couples who are nervous or insecure about the physical intimacy, and it can help the patients couple who struggle to communicate about the sex. And how to find a counselor? It is premarital counseling can be offered by a licensed marriage counselor, family therapist, a certified sexologist, or some religious leader with a specific training. And the couple can reach the qualified sexual professionals through online platforms, mental health directories, or by seeking the recommendation from the trusted sources. How these work? There are sessions between the couple and the therapist or the counselor. They have set of questionnaires that the couple has to fill those questionnaires, and it will help the counselor understand the relationship and identify the potential conflicts. So significant part of this process involves an open dialogue, which is guided by the therapist. So the sex counselor help in opening a dialogue between the partners regarding the sex. He talks about the likes and dislikes concerning the foreplay, orgasm, and other key part of the sexual intercourse. These are the sets of questions that the therapist can give you. As regarding the intimacy and sexuality, there's a questionnaire regarding communication and conflicts, and questionnaire regarding personal history and the feeling. They have got sexual. They have got the forms on which all these questions are written, and patient have to tick mark those questions so that the therapist can know where is the problem. So awareness is very, very important. Often the couples, they fail to communicate properly about their desires and fantasies regarding the sex. Talking in front of sex counselor help the couple discuss everything about sex, ranging from the sexual frequency to the compatibility. There are misconceptions and fears in the mind of partners. Because there is no sex education in the school, no concept of sex education in the family, and there is no concept of discussing the sex in the family. So myths regarding the sex in the young couples, like masturbation, premarital sexual practices, premature erectile dysfunction, or the fear of sexual performance or sexually transmitted disease, how to plan pregnancy, how to have the contraception. These all fears and misconceptions can be allayed by the help of therapist. There's lack of knowledge regarding the safe and unsafe days in the menstrual cycle, and there's also unprotected sex and unwanted pregnancy in the couple. So counseling will help such couple to plan the pregnancy, and when they are they will be prepared mentally, physically, and financially. When they are prepared, they can have the pregnancy. Many of the couple, they don't understand the basics of the HIV or the AIDS. They don't know how to use the condoms properly, and leading to unwanted pregnancy, unanticipated pregnancy. The pre-marriage counseling helps the couple to gain the knowledge about the same. And the first night failure is trauma to the couple. It leads to the marital disharmony, sexual disorder, disturbed family life, and divorce. And the premarital counseling will help them in this. Couples, especially the women who will be engaging in the sex for the first time, they will not feel scared about the activity when they get the counseling from the sex counselor. And the sex counseling will do away the misconception and the clear away they will have the satisfying sexual experience. There has been a study in which they have studied I'm so sorry. They have studied the effectiveness of these counseling program on the sexual satisfaction. They have concluded that the levels of sexual satisfaction, they were shown to be higher in women and men who had, in the experimental group, who had attended the premarital sexual counseling than those in the control group. And there is a recommendation to encourage the engaged couple to attend the premarital sexual counseling based upon these findings. It is also thought that the intervention plan, which is prepared within the framework of information, motivation, and behavior skill theoretical model, it will help the nurses guide recently married couples to great sexual satisfaction. So there has been misconception about the marital counseling, that counseling is only for the couple with major issues. No, it is beneficial for the couple who want to deepen their intimacy, improve the communication, and prevent the future problem. So it is a proactive step toward the building a strong foundation, not the last resort for failing relationship. Another myth is that discussing the sex with stranger is awkward and uncomfortable, but the counselors, they are trained professionals who create a safe, non-judgmental environment in a confidential manner, which where the sensitive topics, they can be discussed at ease, and the goal is to move fast the embarrassment and the open the dialogue between the partners. Another myth is that counseling means the couple is incompatible. No, it means the couple on the united front wants to have they have got mutual understanding, and they have got mutual satisfaction also. They want to have a good relationship. Another myth is that the therapy focuses only on the sexual act itself. No, it also develops on this emotional connection, communication, values, psychological factors, and the broader aspects of the intimacy that impact the overall relationship and the quality. Another misconception is that everybody knows about this, and this situation is uncommon that they don't know. But many people lack this basic knowledge about the sexual health, contraception, STD, family timings, pregnancy timing due to the lack of comprehensive sexual education, and the counseling will provide them a platform to address these gaps with accurate science-based information. Another is that the myth is that counseling will force one partner to change. The counselor just facilitates the dialogue between the both partners, learn the new behavior, and take the responsibility for their contribution in the relationship rather than forcing one partner to change. Another is the premarital counseling guarantees that the marriage will not end up in the divorce. But the reality is that most studies, they show the couple who have undergone the premarital counseling, they report 30% increase in the marital satisfaction. And it is a tool to provide the skill, not guarantee against the future challenges or the unwillingness to work on the relationship. Another myth is that it is the most effective way to learn about each other about through sex only, but actually life after marriage will not only resolve around the sex only, the other things have to work also. So to conclude, the premarital counseling helps the partner figure out the blind spot, correct them. It will help the couple to communicate sexual needs and the ideas effectively. It gives the information about the dangers of the premarital sex, unwanted pregnancy, STDs, unhealthy sexual attachment, and the likes. So it is, as a medical practitioner, we should encourage our patient about the premarital sexual counseling so that they can have a better and healthy marital relationship. Thank you.
Thank you, Dr. Kiran. That was indeed a quite informative and elaborate talk on premarital sexual counseling, and it was a treat to hear you. I now ask our chairpersons to give you their valuable inputs. Dr. Chanchila ma'am, Harsha ma'am, and Suman ma'am.
Thank you, Kiran ma'am, for the valuable inputs on this topic. And no doubt that we should promote premarital
sexual counseling as a part of routine healthcare, and health screening should also be recommended for all the couples before marriage. But living in a setup like this, I'm from Bhiwani. I know it's a very to address these issues, it's always a challenge because of the cultural barriers. But still, we should do our best for premarital sexual counseling.
Thank you, Harsha ma'am. Do we have Dr. Chanchal ma'am and Dr. Suman ma'am with us? I don't think they have joined. So can you see Dr. Madan, Dr. Chanchal ma'am and Dr. Dr. Suman ma'am? No. Move ahead with this.
They are not there.
So can we move ahead to the session 3?
Yes. Yeah, it was wonderful talk, Kiran ma'am.
Thank you, sir. Thank you.
So with this, we
covered everything. It was very nice.
Thank you, sir.
Dr. Madan,
Yes.
you invite.
Yes. Thank you so much. Now.
Hello. Good evening.
Yes, ma'am.
I'm Dr. Suman. Good evening, everybody.
Yeah. Welcome,
Can you
ma'am.
hear me, sir?
Yes.
Yeah.
Welcome, ma'am.
And it was indeed a very good session by Dr. Kiran about premarital sexual counseling, which is a very important and helps the couple to develop the realistic expectations about the sex and in their marriage. So, ma'am, thank you so much for such a important topic which you have covered so nicely, and we really got it very nicely. Thank you so much, ma'am.
Thank you, ma'am.
Hello.
And I must thank Dr. Madan Kamble for giving me this topic so I could go through it. And thank you, sir. Thank you.
You really give justice to the topic.
Yes, very true.
Yes. Thank you so much, Suman ma'am.
Thank you, sir. Thank you so much.
Yeah. Parul, are you there?
Yes, sir.
Yeah, please.
So coming to our third session after two very enlightening talks by Madan sir and Kiran ma'am. So coming to our third scientific program, Handle with Care Psychosexual Issues in Adolescence. So we have our moderators for this session. Can we have their CVs, please? Firstly, none other than Dr. Girish Mane, who's the state coordinator AMOGS for 24-26. He has been the past chairperson of Adolescent Health Committee, FOXY, past chairperson of the Adolescent Health Committee, AMOGS. So, sir has been doing a lot of work for the adolescent health. So, we wholeheartedly welcome you, Girish, sir.
Thank you.
The next one, being our convener for this program, Dr. Prerna Kishan ma'am, who is a consultant OBGYN infertility specialist, endoscopic surgeon, and she has been invited as a speaker at so many places and has bagged so many national awards. So we welcome you, Prerna ma'am.
Thank you, Parul.
We have two experts. None other than Dr. Ruby Bhatia ma'am, who has been the head at Mulana Ambala, and she has been the ex-professor GMC Patiala, Punjab, and she has been a fellow of ICOG since 2017. She has been the president and life member of Ambala OBGY Society, and she has been the vice chairperson for Academic Week North India Gynec Forum. So we welcome you, Ruby ma'am, wholeheartedly. And the next one being Dr. Vibha Dua ma'am, as an expert for this panel. She's the consultant OBGYN at Dua Hospital, Sonipat, Haryana. She's the president of Sonipat OBGY Society and has been the life member of FOXY IMA IFS Haryana OBGY, and also past senior vice president of Haryana OBGY Society. We extend our warm welcome to Vibha ma'am.
Thank you, Dr. Parul. Thank you.
Thank you so much, ma'am. And I would request Prerna ma'am and Girish sir to invite the panelists for this particular session.
Yeah, Prerna, please invite.
Thank you, Parul, and thank you, our experts, Dr. Ruby Bhatia and Dr. Vibha Dua ma'am, and my co-moderator, Dr. Girish Mane sir. Dr. Girish Bhai is just like an elder brother to me, and it's such a pleasure to have a session getting moderated with his and say sharing the same dais. It's such an honor. He has done so much of work for adolescent health the last maybe 10 years, a decade that he has been working for adolescent health now, and no other better person than him to moderate this session with me. And we welcome our panelist, esteemed panelist, Dr. Kamna Bakshi ma'am from Faridabad Society. She is the residency in Department of OBGYN from Safdarjung Hospital she has done, and she was the Vice President of IMA 22, 23, 24, and the Chairperson of Mission Pink Health Faridabad Society. We welcome you, ma'am, Dr. Kamna Bakshi, ma'am. We have Dr. Bhanubati Sharma, ma'am, from the Faridabad Society with a huge experience of almost 35 years, and she is also the co-owner of Sarma Multi-Speciality Hospital. We are so very honored to have you amongst us, ma'am. We have Dr. Aditya Garg, sir. He's from the Ambala Society, and sir is a consultant in fetal-maternal medicine, and he has been ex-consultant at Brighton Sussex University Hospitals, UK, and sir is a lecturer in OBGYN at Manchester University. He has so many articles and journals to his credit. We are so very delighted to have you amongst us, sir. We have our next panelist, Dr. Manisha Singhal, ma'am. And the one thing good about the Haryana OBGYN Society is that we have felt while coordinating and convening this particular entire webinar is that they were just a yes in a single call. And that's so much of love and affection that we have received from all of you. And we have never met before offline. Not much, even if not less, but then a single phone call and everybody was, yes, very much we are there and we are going to participate wholeheartedly. We have Dr. Manisha Singhal, ma'am, and we have from the Karnal Society. We have Dr. Praveen Tomar, ma'am, from the Sirsa Society, and Dr. Neelam, ma'am, Praveen Tomar, ma'am, and Dr. Neelam, ma'am, from the Sirsa Society, Neelam, ma'am, from the Bhiwani Society. Dr. Neelam, ma'am, is a life member of IMS, IAG, and has been the Zonal Coordinator of Harbogai, and she is in the ex-consultant at Civil Hospital, Bhiwani. We welcome you, ma'am, and we are so very delighted to have you all amongst us. With due regards, we can start our panel, and I request Girish sir to give the opening inputs. Sir.
Yeah. So good evening, ladies and gentlemen, and thank you today's convener, Dr. Madan, Dr. Prerna, and Dr. Parul for this wonderful opportunity. But unfortunately, because of some inadvertent reason, I have to be out of my place, and I'm having my journey towards Yavatmal. So I may miss the net sometimes. But Dr. Prerna, who is one of the bestest speaker of Foxy, she's with me, so I don't mind about my this webinar. So friends, actually, when a child is born, in society, we are taking only two stages of life. I mean, a child and an adult. And whenever a child is treated in the home, even though that boy or a girl, they are in the phase of adolescent age group, there are so many changes going on in their mind and in their body. The parents as well as the society, they are treating that adolescent boy as a child, and that's why many times their psychology is not properly understood. They are not treated in a well manner, in what sense or in what manner they should be treated for. There are so many physical changes going on, like height, weight, development of breast, and etc. Then there are so many mental changes going on in them. They are finding their own personality. They are trying to get the independence. They are interested to explore their sexuality. There are many body issues. There are so many psychological issues in those boys and girls. But unfortunately, we are treating them till now as a child, and they are transforming themselves from irresponsible childhood into the responsible adulthood. And that is why many times the problem happens. When we were child, at that time everything was on the auto mode. I mean, the parenting was not very much developed, or nobody was thinking even to the bringing up of the children, because the family were big. There were joint families. There were so many members in the family to correct the things in the boys or the girls, and even they used to share their thoughts or their thinkings with their cousins and other friends also. But nowadays, because of the small family norm and the nuclear family, there are nobody in the family to discuss all these things. And whenever these boys and girls, they are facing such kind of sexual or psychosexual issues, I mean, they are then exploring through the other half knowledge friends, or they are trying to explore all these things through the media, and many times they are misguided, they are going in the wrong directions, and many things can happen. So as a parent, we should be now a learned parent. There is a science called as parenting, and me and my wife, we are taking programs regarding the healthy parenting in our area. And if time permits, or if there is luck, then we will love to have such kind of program in Haryana also, which is very important. And nowadays, parenting should not be on auto mode, it should be properly known. Every parent should have the knowledge regarding the changes which are going in the adolescent age mind. And that's why even as a doctor, we should also treat our adolescent patient with respect, with dignity, and we should not be judgmental, as per said by the previous speaker. And just to enlighten this aspect, and we should just handle all this patient with very care, and we should not be like adamant, or we should not be like very casual with them. I would say, whenever we are handling the psychosexual or sexual issues in the adolescent, we should be more possessive, we should be more careful than the adult patient. So just to highlight a few things regarding this subject, I am having Prerna Keshan with me as a moderator. Over to you, Prerna, you can start, please.
Thank you, Girish bhai. And that is a real honor to have you all amongst us, and so very important inputs by Dr. Girish sir regarding adolescent health, sexuality, and all the psychosexual issues that revolving around growing adolescent into an adult. And we also know sir is doing so much about parenting. And recently, we would like to, as a team, we would like to congratulate you, sir, for this very vast and mammoth program that you have done in Maharashtra for the parenting, training almost thousands and thousands of parents out there. A huge congratulations.
3,000 parents were there.
Great. Yeah, that was really great. So we have, can we share our screen, Dr. Madan? Yes. Yeah. So is the screen visible?
Yes.
Yes.
Make
Is
it
it in the
slide.
slide mode?
No.
Yeah.
Make it slide share. Yeah, right.
Yeah.
No, it's
So
okay.
if we move around by understanding what is called psychosexual issues in adolescence, then very first thing that we need to understand is that what is the psychological model that we are actually talking about. This is a biopsychosocial model, which is not just about hormones. It is a complex interplay of biological changes that occurs during puberty, the psychological shifts that is related with identity and emotions, and the social factors, of course, that is related to peers, that is the friends, the family, and as well as the media. Now, the key period in the changing is adolescence, the critical phase where individuals begin to change and begin to understand their sexual identity and their orientation, as well as their emotions, and what about the future relationships. So we have to consider everything in complete detail. So if you look at the adolescent mind, the adolescent brain, there is a limbic system. If you look at this, which is actually responsible for all emotions and psychosexual issues, then it is something which develops unevenly. This one thing that develops unevenly, the limbic system, which is responsible for emotions, impulses, rewards, is in the highest gear during the adolescent period. So we can't blame an adolescent child or adolescent growing into an adult that why did you do it this way? Because it is his emotion, it's this instinct by the limbic system that is in the highest gear. When a car is in the highest gear, it runs very fast. And that's the same happens with this adolescent mind. Now, while the prefrontal cortex, which is the decision-making area, the risk assessment and the long-term planning area, this area which is quite developed in us, the 30 plus or the 35 plus adults, this area is just under construction in these adolescent period. So we are actually dealing with something which is quite physiological, that they are not in a state where they can assess the risk, where they can make their own decisions, when they can make their own long-term plannings. They are actually in a state where emotions, impulses, and rewards have the highest amount of importance in their life. Now, this gap can lead to heightened emotional intensity and impulsivity and also risk taking, all of which heavily influence their psychosexual exploration. So, with this very important mindset, with this very basic idea about the psychosexual issue of adolescent, we take up this panel. Now, can any of the panelists tell us what are the four key factors that we need to actually take into account when we come to psychosexual psychosexual counseling or psychosexual issues of adolescents? Anybody from the panel can take this up. Yes, Dr. Neelam, you want to speak?
Okay. Good evening, everybody. Thanks for inviting me. There are four key tasks for adolescents, which we all know is they are so tender, and we have to address all these things at the age where it starts. It should be started beforehand, right before the adolescent, and they should be knowing about this, because actually there are four things which are to be taken care of. First of all is identity, that is figuring out who I am. Like there are certain children, matlab, like in the school when we see some girls they are girlish, and at times there are certain girls who feel, no, I will be like a boy, I will be wearing only trousers, I will not be wearing dresses like those of girls, skirts and frocks. I have myself have come across many children like that. So figuring out who I am, this includes gender, sexuality, values and beliefs. So the next thing is that in this, when we go in detail, we'll further talk about it in detail. The second thing which is important is body image, adapting to the, now this thing has changed.
Yes.
No, adapting to the physical changes in the puberty and societal pressures. Like there are so many changes going on in the child's body, which they are shy of also, and they need to be addressed and tell them that this is a normal thing, which are to be taught about them. And they're more concerned about how they look and what society will say and how they will react to it. The third thing is that peer relations, after once they are in a family, they are growing up in a family, they are exposed to only those things. It is only in the school after certain age, when they are going into teen age, then they are that is from a family centric to peer centric social words. They are going into navigating into friendships and romance. They have to be taught properly and how to go about it. They should be taught properly. And then fourth thing is that about the independence. They want to be independent. I think they think that they are the best of all. We want freedom and all things like that. After that, then how to initiate the counseling about this. The next thing when we come like that, I think Dr. Parveen would be like to taking that question.
Yes, ma'am.
Yes.
Very rightly
Good
taken.
evening.
Identity, body image, peer relations, and definitely an autonomy of the decision making is something that we all need to take care when it comes to adolescent persons changing into an adult. So the identity is that they always have to understand who am I, the gender issues, the sexuality, and the beliefs that we need to understand. The body image changing from, as Dr. Girish sir has very importantly said, the change of the breast and the physical changes, all related to a lot of societal pressures, and also the peer pressure from the peer relations. And there has to be something called friendship where they can navigate their entire fears and then open up. And this is where they can make an independent decision regarding their preparedness towards adulthood. Dr.
But I would like to
Yes.
just say one point more, that at this age, they like to talk to their own group, their own friends, and they would not like to talk about anything to their, even to their parents, unless they
Right.
are made comfortable and the communication has to be open.
Very
That is
true.
all.
Very true. Very true. So, Dr. Praveen, can you add on to how do you move about with initiating counseling in such adults? We know what are the factors that we need to take into account, but how do you actually build that rapport with them so that you can counsel them and that particular they don't feel awkward? Now, how do you go about it?
Good evening, ma'am. Thank you for inviting me on this panel. So, to initiate the counseling on adolescents about the sexual behavior at this age, first of all, we have to build a rapport with them and getting them understand things in less awkward way. We should get them understand what they see as their gender, their sexual inclinations, how they interact with other people's, their family values, their self-esteem, their school performances, their trust issues, all should be taken care of. Also, we should talk about their physical and emotional changes as they are growing up. We should help them develop values to prepare them for a meaningful, productive, and healthy life.
we should let them realize about understanding and taking responsibility for the consequences of their action. We should teach them how to protect themselves from unwanted and harmful relationships. Or we can say we should get them understand the consequences of their and other people's actions so that they should not be at risk.
Very, very well taken, Dr. Praveen. So there's something which is a very small thing that I'd like to mention that Dr. Girish Bhai always says is that when an adolescent comes to you for any such issues, maybe suppose you are walking into a 14-year-old boy's room and you find him masturbating. So there's something that he feels that it's abnormal, but it is nothing abnormal. This is just a part of his psychosexual development. So
Yeah.
at that point of time, if you want to counsel this particular client, then we have to start building a rapport in the sense that you make him sit comfortably, build an eye connection with the child, begin with saying that I am there for you, do not worry, whatever you are doing
Take him
is
in confidence, in total confidence.
yes.
And
That is a very
the kid should not feel awkward when we
Yes,
are explaining him about all the private things and all the sexually transmitted infections or anything like unwanted pregnancies, whatever she can face.
Girish bhai, you want to add on?
No,
We can
most of the
start
time,
the comment.
whenever we are dealing with either as our son or daughter or as a patient, I mean the young boy or girl, most of the people they are talking in a way that they just as if they want to make that child or that girl or boy to feel that whatever he is doing is not only wrong but it's a crime.
Yeah.
That is very wrong. So actually, all of you have already told very in a good, sentences that boy or girl or that patient should be very friendly with you, and they should have some concern with you, and they should be very open up with you so that they can give you the proper history also.
Right. Our experts, Dr. Ruby ma'am and Dr. Vibha, do we have them with us? Dr. Vibha ma'am, do you wish to add something to this, ma'am? Your valuable inputs on this.
Only thing is that, yes, main thing is that every adult child who is going into adulthood or adolescence should be confident with someone, maybe the parents, maybe the teacher, or maybe some friend. But friends are usually not versed with everything, so better is some senior person is involved in this and they should be confident with that.
Yes, ma'am, very rightly said. So the key message that we get from this particular thing is that we need to be clear in what we are dealing with. We do not need to confuse that child who is already much confused about his own body figures and own changes. Yeah, so we need to very clear. We need to tell them that okay, this is not wrong, and this is nothing awkward. You have to take certain unreasonable fears into account and then clarify them all, looking at their relationship dynamics and their trust issues with you. So very well taken, all the panelists. And so if we move on to our next phase of the panel, can I have somebody to tell us about what does it mean when we say about the quest of identity? Like we have said that who am I in relation to gender and sexuality? So everybody knows that I am a male, I am a female. So what are we actually talking about when we're talking about the quest for identity? Can Dr. Aditya, are you here? Dr. Aditya Garg? Dr. Bhanumati ma'am, are you here? No. Dr.
Yes,
Manisha
I'm
ma'am?
here.
Yes, ma'am. So can you enlighten us a bit on what does it mean when we say about the quest of identity for such children when we talk about it? Yes, ma'am. Anyone can take this. Dr. Bhanumati ma'am?
She's
Dr.
muted.
Manish, you are muted, ma'am.
Yeah.
Ma'am?
Bhanu ma'am, unmute yourself.
By the time we can have anybody else speaking on this, Dr. Manisha Singhal ma'am, Dr. Kamna ma'am.
Now we can have opinion of TSS Rao sir, expert.
Sir, Rao sir, if you are here.
Rao sir, are you there?
Sir is there, but maybe sir is busy somewhere. Dr. Praveen, you can take this up.
Yes, ma'am. There is a term called means gender identity. Now, there can be a variation from the person that he or she feels. Means the internal deep-seated sense of one's own gender may or may not align with the sex assigned at birth. So it can be cisgender, means a person's feelings or sense what he or she feels about his or her gender can align with the gender he or she is assigned at birth. That is called cisgender, or it can be transgender. It can be different from what the person is at birth. So a male can feel like a female, or a female can feel like a male. And then there can be a non-binary also, a term where sometimes a person feels like she's a female and sometimes feel like she's a male. So these such kind of emotions keep on coming and going in pubertal age. So we have to tackle these things also in a very sensitive way.
Yes, very rightly taken. So this is something what we mean by gender identity is that there are certain issues which we need to understand that the sex at birth might not be aligning with the behavioral sex. So these are terms where we understand cisgender, transgender, and there is a lot of hue and cry now regarding LGBTQA. And there's a long term related to this. So this is an entire class altogether. So we need to first understand whether the child is feeling safe in his own complexities or not. So if we move on to the spectrum of sexual orientation, then the key terms can be something like an enduring pattern of emotional, romantic, and sexual attraction. Whether your child is attracted to a boy is attracted to a girl, or a girl is attracted to a girl herself. Whether they are hetero, whether they are homo, or whether they are bisexual. So the key terms that we need to understand in this is a journey of discovery that exists on a continuum. That continuum, the thing is about pansexuality, whether they're attracted to people regardless of their gender. So this is something that we need to understand when the child is growing up, and early the better. If we discover it at the age of 16, it's better rather than discovering it at the age of 28. So, Dr. Neelam, do you want to have any input on this? The spectrum of sexual orientation, but of adolescents. Do you have any input on
Like
this?
sexual orientation, that is what I was telling you. Some people, like girls, are usually they are having only girlfriends. Like they have their own set of emotions. They can open up with only those girls, children. Some are attracted towards the other sex, like boys. They have boyfriends, and their group will be like that. That is an inherent sex what they have given by birth. So they are more comfortable by them. Sometimes people are attracted to the only same gender, and sometimes to the opposite gender. Sometimes it is with more than one gender. We need to know about this, and they should also know about it, and it should be discussed whatever it is there in their mind, and it should be tackled like that. Then there are certain things, other thing what I can say, I'll tell you. Key terms are there. There is a pansexual that attracted to people regardless of their gender. That is what I said. It can be a boy, it can be a girl, or even to the parents. And sometimes with other this thing, asexual, certain children, they have no attraction absolutely towards anything like that. They would not talk about sex. They are not at all interested. Some are more interested, some are less interested, and some are very few. Similarly, this thing, what is it? Questioning the process of
Not an issue, ma'am.
one's
Yeah.
different questions. We can ask the children to know about them, what they're interested in. That is the basic thing. Like homosexual, heterosexuals, and bisexual children are there. Like that. That is
Very
how
well
the
taken.
personality and the orientation we can get to know about the children and
Yeah.
guide them accordingly.
Viva, ma'am, you want to say something?
Only thing is, I am in favor of this, that it should be detected at the earliest.
Yes. Rao sir, are you there?
Yeah, their
Rao sir?
liking, or it should be detected at the earliest, maybe by the age of 16, 17, 18, or like that.
Yes, ma'am, very much. We should tackle it early, the better. So,
Yeah.
what are the hurdles and headwinds that we actually face while we are actually dealing
More
with
important.
psychosexual challenges in adolescence? There are certain loopholes, and there are certain areas of problems that we actually face. Out of that, The most important being body image and the puberty and social pressure that we need to understand. So can somebody enlighten us on what about the body image and her how adolescent triggers? There's an intense focus on physical self. Can any panelist or any of our experts can
In body image, what happens is this is a person who's neither a child nor an adult. She is maybe she is an adult in a child's body or a child in an adult's body. Now her or his body is maturing, but the mind has not matured that much. Though the person, so that person is confused. Then media shows various body images, like you have those thin beautiful girls and those girl and masculine boys, so they want to have that sort of an image, which is not possible. uh, these things are not practical, so that is one problem. And
that's a very
adolescence does an intense focus on the physical self. Puberty changes are often compared to unrealistic ideals seen in media and online. This can lead to significant body dissatisfaction, anxiety, and impact self esteem and sexual confidence. It's a core psychosexual challenge of adapting to a new body. And the others are stress, anxiety, guilt, depression, and trauma. The child just does not know what is happening to his or her body because of the physical and the hormonal changes. And like it takes to adjust with everything in life, here also the child needs a lot of help and counseling to adjust.
Thank you, ma'am. Thank you, ma'am. Very well taken. Girish bhai, do you want to add on something on this very important area of concern? If you're there.
No.
Yeah. So if we move on to what next, what are the higher odds that we actually face with adolescents? So we are actually seeing a rise of suicidal attempts in the adolescent age group. What was earlier maybe 1 is to in lakhs, this is now into hundreds in lakhs. So what to understand that the factors influencing psychosexual behavior of adolescents, the number one was body image, number two was maybe a media pressure and the peer relations and pressure. How does actually social rejection and bullying affect these particular children? Can anybody take on this? Something regarding social rejection and bullying from the peer group. How does
Yes,
it affect these?
friends do bully, classmates do bully. Now, a simple example is because of hormones, a boy has gynecomastia. That is enough to drive him to suicide because all his friends cause so much problems for him, make so much fun of him. Some of these boys undergo surgery for that. Uh, Same with girls also. So, because of that peer pressure, because you're not understanding what is happening, and because of that bullying, some people are not able to take it. Some are mentally strong. It is okay. Some are not able to confide it to others, and they may even be driven to suicide. They have anxiety, they have depression, just because they do not understand what is happening with them. And there is no one to take up their case to understand and to counsel them.
Very importantly that we need to understand is that the higher odds of suicidal attempts, it has increased almost 3.5 folds in the last 2 decades with the advent of social media, and considering this entire family values to peer centric life. Earlier the life was family centered and home centered, but now the life of these children is peer centered, and this peer centered life in our families will fit in our babies as they are, will accept them as they are. But in this peer centric life scenario, they have to make themselves fit in. Then that brings the pressure, that brings the values of disparity, and that brings the attempt to suicide. That is what we
Here,
need to
here I would like to add one point that is very important. What I feel is, at this age, the moment the teenage starts, the parents have a very big role to play. Either one of the parents, they must know what social media they are getting it into and what they are watching. There, it is a very, very important thing, because I think most of the children, not only few are who are headstrong, even those who are headstrong, still they undergo this peer pressure and social pressure these days is simply too much. and this media check has to be there, and not that they should be scolded what you are seeing, this content is not to be seen. At least one of the parent or some elder in the house should be there to tell the child what is right and what is wrong, and you should not be bothered about this, because these things are also, even after the social media also, they give you the best of everything, and children think that that is the right thing, and everybody tries, and even parents come with the pressure, and at times children don't even go home and tell them that this is the problem they are facing, and parents also don't get to know. So social media check is very important
Very
aspect,
true.
what I feel is at this age.
Girish bhai?
Yeah. Actually, the most important point in anybody's life in adolescent age group is the peer pressure and the social media. What exactly the peer pressure is, and everybody knows that smoking, alcoholism, or getting indulged in the premarital sexual activity, it is wrong. Then why these boys and girls they are getting engaged? Actually, we are the social people. We want to be in society. It is very difficult to stand alone, but it is very easy to be in line. Correct. So that's why everybody, every boy or girl, they want that they should be accepted by their peers. And that's why many times what happens, the wrong things they are done in the peer and they have to accept this. Actually, peer pressure is of three types. One is the positive peer pressure, where a boy or a girl can do some good things in the sports or in the academics by just watching their friends or by getting encouragement from their friends. Then one type is a neutral peer pressure. For example, if any class is good for the NEET preparations or the JEE preparations, then they will join those classes. And there is something called as a negative peer pressure, where most of the disasters they happen is the smoking, alcoholism, drug or substance abuse, you can say, or social media, watching the pornography and all these things. They are the effect of the negative peer pressure. And social media is one of the most important point nowadays. The most important thing is the parent themselves, they are so much getting engaged in the social media activity, that their children they are following their parents. And that's why, just to if any parent they want that their child should be away from the social media, there should be certain rules in the family. For example, nobody can watch this or can be on social media whenever they are in the family function. Then there should be no use of social media in the bedroom or on the dining table or in the family event. Such kind of things should be done. And a small paper can be displayed in the center of the hall or any conspicuous place, which is I'm telling you all the negative effects of the social media. You will be surprised to know that one adolescent clicks more than for they are clicking their phone for more than 2,000 times in a day unknowingly. Then they are getting distracted. Even they are not getting any notification or even any call. Then in most of the boys and girls, their sleeping partner is their smartphone, and they are getting their life miserable without the smartphone. This is the reality. And in my opinion, there is no role of smartphone till the age of 18. By anyhow, actually, the boys and girls they are telling lie to their family that we are getting the notes and other activities to the smartphone. But the reality is that no school is getting use of this smartphone for any academic purpose. So it is the parent who can decide where the child should go in concern with the social media. And the first thing every parent should do, that they should have check themselves on the social media, and then it is possible for the peers, for the
Yes,
children. Sorry.
very true, very true. And very importantly is that social media projects life which is very perfect, and they are really giving out unrealistic standards of body image, which is actually not right, as one of our panelists have already mentioned. So this is all that we need to actually take into account, including cyberbullying, where harassment and social rejections are still getting on the higher trend. Now, moving on to our next phase of this panel.
And one point I
It's
want to
already
say is
yes.
after COVID also the use of phones and online classes, it increased the
Very much,
exposure to adolescents.
very much, very much.
Otherwise, we
So
would not give them phones. But because of these online classes, we have to
Yeah,
give phones to the children.
yes,
And
ma'am.
naturally,
Yes.
where they use it, they will misuse it also.
Yeah.
yes, they keep on opening new
Means under
windows.
under parent guidance, we should always give them phone.
Yes,
It should be
yes. So
guided.
this is something we have spoken in quite a depth, how the digital and the social media world is actually affecting our adolescents, where pornography, texting, sexting, and misinformation is being taken into account, with harmful myths and misinformation found online. So we need to handle with care, as we have already named the panel. Handle with care, please handle with care the social media and everything that is on the internet. So how do you deal with the altered psychosexual behavior? Like, how do you build a support system? We have said something regarding
Here I
family
would say,
support.
like, taking care of the social media, I think the children should be warned beforehand that they should not be sending any photo. They should not be allowed to take any pictures which are misused by them, like blackmailing and using it on other platforms. That is very, very important. These children have to be taught somewhere in the schools, or means like all children should have the knowledge about it, so that they are not. I have read at times that children are being clicked like that, and they are blackmailed like that. That is very, very serious matter, I would say here.
Yes, ma'am.
Yes,
Yes.
they modify the photographs.
Yeah,
Yes.
And
they
then
modify. AI is there, and
In
like
the world of AI,
changing the
everything is
faces
possible.
and whatever is, so children should be aware of it.
Our
so
expert,
this
Dr.
sort of
Dr.
security is necessary for everyone.
Yes.
So they should not be getting their photos clicked
Even these online
and not
gaming apps
sharing.
also, they are also dangerous at one point. I've
Yes.
seen an interview where Akshay Kumar was saying that his daughter was in online gaming. She was online gaming, and one person with whom she was gaming suddenly out of bold asked her to send nudes. So these are the things, na? For a celebrity, even for a celebrity's daughter, this happening. So we can expect any child is miserable, and anyone can be hit by these cyber bullers.
Dr. Vibha,
Madam,
ma'am.
once any photograph is taken in the smartphone, and even if you are deleting it, it is a myth that it is deleted. It is stored somewhere. Somewhere it is stored, and it can be
Yeah.
reused again.
Yes.
Even if we are deleting anything from Facebook or from WhatsApp or from internet, once you have entered that photo, that entry will be forever. It cannot be deleted.
Means, sir, to use smartphones, we should be smart enough. That is the thing.
Very true.
No, we are smart enough, but
Exactly.
those children are not smart.
So we have to make
We have to make them smart. We have to guide them.
Very interestingly,
also.
this panel is turning out
Yes,
into be
ma'am.
a day-to-day parent and
Practical
child
problem,
counseling.
practical
It
problem,
is very,
practical
very
thing.
much, very, very practical panel that we are having. And the
Well, we are
most
all parents, aren't we?
very burning topic that we all are discussing, the phones, internets, and our children. Dr. Vibha,
And
ma'am.
ma'am, nowadays the reels, these kids who makes the reels and for the followers, they are making more and more means exposing reels. So this has to be also taken care by the parents, that should not allow
The
them to
parents and the
wear or
guardians.
enact like in a bad manner, just to be more followers on their YouTube channels, and whatever is happening is not good.
Yes. So the more the followers, the happier they are. This is
Yeah.
this is the new age.
And even if they don't receive the followers, then also they are going into depression and taking extreme steps.
Yes, yes.
That is also a problem.
Our expert, Dr. Ruby ma'am and Dr. Vibha ma'am, do you have any take on how can this conversation between the parent and the children, that the big talk, I'll wait for the big talk day. No, the talk has to be ongoing and it has to be an open dialogue on a day-to-day basis. Mitra ma'am is also here. Mitra ma'am, you want to add on to this?
Basically,
I'm listening.
So nice you're here.
Doctor.
Yeah.
Basically, parents have to be very friendly with the children. Like on Instagram, they are posting so many reels and videos and all.
Good evening, sir.
They have to be very friendly. And
Sir, allow me OPD na Baramati Hospital na.
yeah, someone.
Hello,
Madan,
Dr. Madan
Madan,
Kamble
you are, Dr. Madan, you have to mute.
So, parents and children, they should be very friendly, I think so. Only then they will be able to know that what their children are presenting at Instagram and all. Otherwise, they will hide everything. They make the post, they make the account also private and like that. So again, parents have to be friendly with the children to know, and no
Thank
one
you, ma'am.
else can, I think, guide them much better
I
than
can say
parents.
only one
There is
thing.
some disbelief.
Yes, Mitra,
I
ma'am.
only want to say one thing. This is from my personal experience that when my daughter was an adolescent and a teenager and growing up, so what you are saying, na, Vibha, I was trying to do that, trying to be a very good friend and listening and everything. But what happens is that हम जिस era के अब I don't know नए parents कैसे हैं, हम लोग का था सब कुछ सुन के दोस्त बन के फिर उन्हें एडवाइस भी करने लगते थे. So then my daughter one time told me कि मम्मी stop trying to be my friend because you can never switch to being a friend. You will always become the mummy. तुम हमेशा मुझे
I
एडवाइस
know that,
करोगे which is I don't want.
but they should be
मैं तो अपनी
confident enough
गलती
to
बता रही
share.
हूँ
हाँ
कि
मित्रा,
हम
मैं
लोगों से
जानती
रोल
हूँ.
प्ले नहीं हो पाता है तो मुझे लगता है
At
कि
times children say, you just listen to me. You don't need to advise every time.
Silent,
Advice के
silent,
लिए नहीं बोलते.
I am just sharing it with you to
silent
share it.
supporter.
पर नीलम
Just
ये
have
ना
to.
अब बड़े हो गए हैं ना, अब बड़े हो
Yes.
गए, अब ये कहते हैं. जब ये छोटे थे ना तो हम लोग सोचते थे कि अरे हमको जरूर एडवाइस करना, हमने ये गलती करी है. बट आई एम श्योर प्रेरणा
मानती हूँ.
फॉर यू ऑल
We
दिस इज अ
just
वेरी
listen
बिग
and not
लेसन.
advise.
So
We
we
should
just
listen and not
we will
advise.
Mitra ma'am, we will just try.
पर हमें इस स्टेज पे तो होना है कि वो हमसे शेयर करें एटलीस्ट.
Ma'am, we are
इतना
silent
इतना तो
supporters.
बीच में होना चाहिए ना आपस में.
The
Sure, we have
panel is really
to be
turning
there.
out to be steaming.
Yeah.
Thank you so much.
When any girl she thinks that her mother was right, at the same time she is having a girl who thinks that she's wrong. So it is going. I mean, it is a role between the parents and the because of the generation gap. What I will suggest to all the parents that there is a one very good rule of 21. I mean, even if you are very much busy with your practice or with your business or whatever things you are doing, at least one parent should give only 21 minutes to their children. 7 minutes in the morning before going to the school, then 7 minutes after returning from the school, and 7 minutes before going to the bed. And in the morning, if you are asking every day a single question that, beta, have you completed your homework? And what about your friends? And what one good thing you are going to do today? So after 2-3 days, 4, what will happen after that boy or girl, he will feel that my papa is going to ask me about my homework, so they will start doing homework. Then after coming from the school, if you are asking what one good thing you have done in the school, then they will start to do something which should be like, I mean, they should have some substance to discuss with the parents. And while going to the bed, if they are going with good, good atmosphere or good thoughts, definitely they will get many benefits out of that, and that will build the relation with the children, parent, this parent and children relationship. And the most important thing,
So nice.
what the parents they are thinking that if I am giving a separate room to my child, if I am giving a good quality phone to my child, then I am doing a good parenting. No, it's not our culture. Just to give the proper time, that is the most important principle of parenting. And उनको हमारे ज्ञान की जरूरत नहीं, हमारे ध्यान की जरूरत है. हमारे प्रेजेंट्स की जरूरत नहीं, तो हमारे प्रेजेंस की जरूरत है बच्चों को. और वही हम आजकल मिस कर रहे हैं. एंड वी आर थिंकिंग दैट वी आर गुड पेरेंट बिकॉज आई एम गिविंग अ good school for my child, I am giving them a good phone, I am giving a good vehicle, I am giving the good this clothes and everything. So I think to give the time and to share the time with the children is the most important and core principle of parenting, in my opinion.
100% सही.
Very
Girish?
true.
Right, sir.
एक बात बोलूं
Very true.
प्रेरणा,
We just
सॉरी
have
दिस
to
इज
create
ऑफ योर पैनल.
yes, yes.
गुड
नहीं
थिंग
नहीं
इज
मैम
कि तुम्हारी पैनल में ऐसे पेरेंट्स हैं जिनके बच्चे छोटे हैं, बहुत छोटे, जैसे कि तुम. प्रवीण है, गिरीश है जिनके की बड़े, और नीलम हूँ, मैं हूँ, विभा है, हम लोग जिनके, डॉक्टर रूबी जिनके बच्चे मेच्योर है.
So
So
whatever
it's a
we are
good mix.
discussing is evidence based discussion.
Yes, very good, very nice. We
No
We
more
are
just
the
variety is there.
experienced people speaking with our experience.
Yes.
So we just have to create a safe, non-judgmental space for our children. That is very important. And everybody is sharing their personal experience. So very nice to hear them. As we move ahead with this panel, because we have 2 more minutes left, and we look about the role of schools and educators. Definitely, we have talked into much detail about the role of teachers and the comprehensive care that they need to have during sex education in schools, and the topics of sexual orientation has to be dealt with in the curriculum that is has to be incorporated, and we obstetricians need to do something about it to incorporate this sex education into the curriculum of the schools. And this is a very simple guideline on how the reliable sources for such information seeking on sex education, where we have many online trusted forums also, as well as certain medical helps that we can entrust upon doctors and pediatricians. There are crisis lines, and there are mental health supports team like the psychologists and the school counselors. So with this, we come to our
there I would say
yes,
one
yes,
thing,
somebody.
just one line, that we gynecologists as a expert, or we can go to the schools and take the small lectures for this adolescent from 9th to 11th class or 7th to 9th class students, and some reorientation programs can be helpful to the children.
Yes.
Yes.
Very
Madam,
good message. Very
me
Ma'am,
good.
I
and my
just
wife,
wanted
me
to
and
say that the Trevor project is now shut by Trump since 2017, so it's not functioning.
So
The
madam,
Trevor
me
project
and
you
my wife, we
mentioned
are doing
online.
yeah, we are doing this
Yes.
adolescent health education program in the schools since last 8 years, and we must
Yes.
have taken this I mean given the talks for more than 2 lakh girls till now. So we are doing
Very nice.
very regularly. I mean at least 1 or 2 programs in a month.
Very nice.
Very good. So with this, we are time's up with our panel, but we'll definitely take one key take-home message from each of our panelists. We just need to understand that the psychosexual development is a normal, complex, and a unique part of every adolescent's journey. Identity exploration is a process and not an event. And open communication, education, and unconditional support are the most critical tools to help them navigate it safely and address early to have the optimum benefit. May I have one key message from each of our experts and all those who have joined in, Dr. Girish sir, and all our panelists. Dr. Vibha ma'am, we can start with you. One
Mine is
message,
same.
one liner.
Address early for optimum benefit.
Girish bhai, you are there.
I'm not giving key take home away, but my question is, if we are trying to be friends of our kids, then who will be the parent of our kids?
Yes, very good. And very nice, sir. Dr. Kamna, Dr. Bhanumati ma'am, if you're there, Dr. Aditya sir, if you're there.
There is no, but always I feel that there should be some limitation for becoming the friends of our kids also, and you should be more projected as a parents and not as a friend, because
Yes,
Be a friend to your children and lend a sympathetic ear. And at the same time, you have to be strong, assertive, and
Dr.
not give
T.S.
them a lot of freedom.
Thank you, ma'am. Dr. T.S. Rao sir is with us, sir.
Oh.
One liner message.
Sorry,
Give us, as
we had some guests here and had moved little that side. I missed you at this
Yes,
panel
sir.
discussion. Of course,
So any message on psychosexual issues?
it is really nice that this is one of the very important area you people have chosen, and very detailed deliberations have happened. When we are trying to talk about this adolescent education and that panel discussion that was happening, these young people, we need to treat them as our friends. I think this is one of the most important message. We try to impose something. There are only two things that are correct. Some people listen, but some people rebel. And there is the time, actually, in fact, any shoulder is available easily, and that's where actually we miss them out. So this is the important message.
Thank you, sir.
There is no shortcut for education, and this type of things actually sensitizes us and everybody how to go about. All the
Thank you,
best.
sir. Thank you, sir. Dr. Praveen, Dr. Neelam, are you there? Your last.
I just want to say that we should stop expecting them to behave like a grown-up and yet be treated like a kid.
Very nice. Thank you. So, with this, we.
I wanted to sing a song. जो
Oh,
ना
great.
बड़े हैं ना छोटे, बड़ी मुश्किल में है पड़े, ये गाना था. और मेरा
Ma'am,
अपना टेक ये है कि children will always thrive when the atmosphere around is good. So basically, it's not just their psychosocial development, it's every thing. So parents have
When
to
the
fulfill a very,
environment
very
around them.
positive role.
Yes,
If a
ma'am.
marriage is dysfunctional, you can expect that the children will not thrive. They will have lot of issues. So if any couple, that is what I do in my practice. When any couple comes for infertility or anything, early pregnancy, I always even try to see in between कि इनकी personal equation अच्छी है कि नहीं. You know, we as gynecologists have a very big role to educate our patients कि तुम बच्चों के साथ आगे कैसे behave करोगे. It's a lifetime journey. So I feel parents को बहुत mature और अच्छे से अपनी responsibility को प्यार से लेना चाहिए, because children need a very good thing. And of course, what you all have talked is really very pertinent. I'm glad, Madan, that I was here as always.
Yeah, thank you so much, ma'am.
Yeah,
Yeah.
so
It was
Girish,
a
I just
wonderful
wanna
discussion.
So in
Ah,
my
sir.
all parenting classes, I always give two examples with, I mean, they are in the start of my program, that which life you will like to have. A life of Vijaypat Singhania, who wrote the book Incomplete Life, was the Padma Bhushan winner, and who created a company worth 12,000 crore rupees, that is Raymond's. Or you want to be like Harivansh Rai Bachchan, who is living his life very peacefully, to have the son like Amitabh Bachchan. And Vijaypat Singhania has that fellow Gautam Singhania, who you must be knowing, who destroyed the life of Vijaypat Singhania after doing so many things. So parenting is not only a time of your or a period of your life, but it is investment of your later stage of that geriatric age group.
Thank you, Bhai. And thank you all our esteemed panel and our expert and Rao sir and all our chairpersons. And thank you so much for being there. I humbly seek blessings for my election year 2026 as a chairperson for YTP committee. And I hope I get your wholehearted support for this. Thank you. Thank you so much for being there.
Yes, you will, and wish you all the best.
Thank you, ma'am. Thank you. I invite Dr. Madan Kamble, sir, for your vote of thanks. Sir.
Yeah, thank you so much. It was really a wonderful discussion, actually, and it has covered almost many aspects of the psychosexual things in adolescence. And thank you, Girish sir, for highlighting so much things and being here with us for this important topic. I would like to thank you all the panelists for great inputs. A special thanks to TSS Rao sir for being here. And on behalf of AMOGS Sexual Medicine Committee, I extend my thanks to Chief Guest Dr. Narendra Malhotra sir, or all the guest of honors, Nisha ma'am, Mitra ma'am, Ragini ma'am, everyone here, and all the office bearers of all the societies of Haryana who have consented, agreed with a single call, talked with very love and affection. Actually, we like uh, this love and affection from Punjab and Haryana also. 15 days back, we did with Punjab. Physically, I never visited Haryana, but very soon I will. And thank you so much for this wonderful event. We enjoyed the academics and all the opinions and inputs from all the great practitioners and Foxians. In future, I would love to connect again with you all. And myself and Prerna humbly seek the blessings in upcoming Foxy chairperson elections. I'm going for Sexual Health Committee of Foxy, and Prerna is going for Young Talent Promotion Committee of Foxy. Thank you so much.
Best of luck. Uncontested जीतो, ये हमारी good wishes हैं.
आपकी blessing रही तो सब हो जाएगा मैम, सब हो जाएगा.
अरे पूरा हरियाणा तुम्हारे साथ खड़ा है, don't worry, you both.
Thank you,
and of
ma'am.
course with our Kiran and
Yes,
God bless.
today Gurgaon people could not join because they are having physical CME today.
मैम एक बात मुझे बोलना है मित्रा मैम आपके लिए. आई एम जस्ट अ फैन ऑफ योर वोकैबुलरी. आप कुछ बोल दो अंग्रेजी में, एक लाइन अंग्रेजी वाली बोल दो आप. अच्छी वाली
spontaneous.
अब ना ऐसे तुमने सेल्फ कॉन्शियस कर दिया, अब तो कोई गाना ही आ सकता है, अब कोई डायलॉग नहीं. Never
Thank you,
mind. I
Rao
think
sir, for being there till the end.
it was really very useful, and everybody has participated very actively. I think it is your topics today were very, very relevant.
Yeah.
Thank you.
Wonderful.
Common topics should be discussed always.
Yeah, definitely.
Thank you, ma'am.
Thank you,
Bye-bye.
Prerna. Thank you, Parul. Thank you, Parul, and thank you, Corona Remedies, for the academic support. Thank you so much.
Bye everyone.
Bye, Girish sir. Yeah.
Chalo, bye.
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 Chalo,
Hello.
bye. Thank you, Prerna. Thanks a lot.
Bye.